So, student, in this topic, in this lecture, I want to discuss about general principles of treatment of poisoning. Okay, general principles of treatment of poisoning. Okay, so any poisoning. Okay, any poisoning, any chemical. Okay, so what is poison? Any substance which, when it is introduced into the living body, or by any means are brought to into contact with any part of the body, which causes local or systemic effects, which results into either ill effect or death. Okay, so is called as poison. Okay, when you consider poison, any substance, any chemical, any substance, when introduced into the living system by any means, by oral, maybe topical, maybe inhalation, maybe injections. Okay, when introduced into the living system, by means of any, okay, maybe injected or coming contact with your any part of the body, which causes local, when it is happening local, whenever applied on the topically, local or systemic effects. Okay, effects systemic toxic effects. Okay, with this, okay, it results into either ill effects. Okay, ill effects means it cause ill. Okay, so not safe. Okay, and death of individuals. Such substances cause a poison. Okay, so once the poison is happening, what are the procedure you have to follow, okay, in order to overcome the poisoning, is called as the general principles. So these are the principles. When you know the general principle, you can apply the any poisonings, depends upon the type of poisoning. Okay, so with this you can pick up some or more steps for the management of the poisoning cases. Okay, this is called as a general principles of poisoning and management. Okay, so first thing is, what you have to do is you have to do the stabilization. Okay, uh, generally I will explain, okay, with the content in the ppt and as well as without ppt. Okay, but you can note down in our textbooks. Okay, so first two thing is, so these are the 5 6 steps you have to do. Okay, so stabilization and evaluations, and decontamination of the gut. Okay, gut sterilization is also called gut sterilization, gut decontaminations, poison eliminations. Okay, administration of antidote, nursing care. Okay, psychiatric care. Okay, so first what you have to do is stabilization. Okay, so direct initial investigation towards assessment and correction of the life threatening problem if present is the prime focus. Okay, so major focus in the any poison condition is, you have to keep the patient alive. Okay, how you are going to be keep the patient alive? By providing essential thing. Okay, so essential uh, maintenance of essential things. Okay, main is one is circulation, one is respirations. Okay, circulation and respirations. So how to maintain the respiration? Okay, respiration mainly provided by, okay, either artificial respiration by providing oxygen. Okay, next is second one is, okay, mouth to mouth respiration, Okay, first you have to maintain the respiration by providing oxygen, sufficient oxygen. Okay, next is circulation. Okay, circulation, immediately you have to maintain the circulation. Okay, circle in the sense, you maintain the blood circulations by immediately you correct the blood volume by giving any blood substitutions, maybe whole blood or either part of the blood products. Okay, so in order to prevent the shock. Okay, second one is transfusion fluids. Okay, iv transfusion fluids like saline, Okay, next is BP maintaining drugs, vasopressor drugs, adrenaline. Okay, so these are the drugs. Okay, right. So immediately you have to maintain the respiration by providing respiration, and maintain the circulation by immediately giving blood transfusion, IV fluids transfusion, fluid and electrolyte transfusion. Okay, so next is maintenance of the blood pressure by giving vasopressor drugs and cardiac stimulants. Okay, so with total together is called as, okay, card so before reaching to the hospital, once the patient is reaching to the hospital, you can provide oxygen is there, and as well as we maintain the blood pressure. Okay, no problem. But before reaching to the hospitals, there is some problem. If any problem taken place, in such cases you can follow the one method, cardio pulmonary resuscitation. Okay, cardiopulmonary resuscitation. Okay, so what is cardiopulmonary resuscitation is nothing but immediately you can provide the mouth to mouth respiration, and also you apply the some positive pressure on the ribs. Okay, on the ribs with help of your your hands. Okay, your hands, you immediately you have to pump that here in the chest, so in order to reactivate the heart. Okay, this is a cardiopulmonary resuscitation. So later on, if possible, I will get into, I will download and share the material cardiopulmonary resuscitation, so you can ready with also. Okay, in some case they ask whole thing in examination. I explain about the general principles of poison treatment, or otherwise they specifically ask this particular method, cardiopulmonary resuscitations. Okay, please careful. Okay, so then immediately after pulmonary resuscitation, with this the same thing you can provide. Okay, ABCD. Okay, you can provide ABCD. So what is A stands for clearing of the airway. Okay, clearing of the air. Same, this ABCD, ABC comes under these primary functions only, and they are providing a respiration and providing the circulations. A stands for, okay, clearing the airway. Okay, clear the airway. So any obstruction, any physical matter is obstructed in the passage of airway, immediately you have to remove the physical matter. Okay, so that you can clear the airway, so by providing proper respiration. Okay, spontaneous respiration. Next, B, breathing. Immediately provide the breathing, so by mouth to mouth respiration. Okay, as a first aid. So once it is reached to the hospital, you can provide the respiration. Circulation, already I told you, you maintain the circulation. Okay, by following cardiopulmonary resuscitation. So okay, reactivation of heart rate. Okay, reactivation of heart functions. Okay, cardiopulmonary resuscitation. Once is enter into the hospitals, okay, maintain the circulation by giving you maintain the blood volume, maintain the circulation fluid volume by giving blood transfusion, fluid transfusion, electrolytes transfusions. Okay, so vasopressor agent and cardiac stimulants. D stands for depressions. Okay, so you prevent the development of depressions. Okay, so you can give moral support to the patients. You give moral support to the patient, so that the patient don't go much panic, anxiety. Okay, so like that. Okay, so you give some encouraging words. Okay, this is about the first thing you can do. Okay, immediately after poisoning happening. Okay, so next thing is you rest. You can assess the coma severity, and the following scales can be used. Okay, suppose if the patient is enter into the coma, you can assess the coma severity by using these scales. But you can simply write coma scales. Okay, Glasgow coma scales, Redis Glasgow. Okay, these are all the things you can simply write. Okay, next, in order to prevent the coma, okay, you can give this coma cocktail. Okay, so according to the Hoffman and gold rank for comatose patients in general, where the patient poison is not identified. Provide the coma cocktail to prevent the coma. Okay, suppose if the patient is chances for enter into the coma, you prevent the coma, so you can give coma cocktail. Okay, cocktail is nothing but mixture. So cocktail consists of three antidotes. One is dextrose, okay, 5% solution, 100 ml given by IV, along with thiamine B1, okay, 100 mg by IV. Naloxone, okay, naloxone, okay, is a opioid antagonist. Next, okay, this is about coma cocktail. Immediately you have to give to the patients to prevent the getting of coma. So next, for metabolic acidosis, okay, metabolic acidosis, you can calculate the acidosis and you have to correct the metabolic acidosis. Okay, next is next is, you suppose if the patient is failure of respirations, uh, if the failure of respirations caused by anything, okay, if the toxin associated, if the failure of respiration happened by antidepressants, neuroleptics, ethanol, sedatives, succinylcholine, nicotine, okay, any poisons, okay. uh, Here they mention some toxins. So what are the toxins characteristics? Some drugs produce respiratory failure, some drugs produce respiratory paralysis, some drugs produce tachycardia, some poisons produce hypotension, so like this. So this is some drugs, okay, you can just write down. Okay. Next is here is also metabolic acidosis and all. Okay, so this is about, okay, so first what you have to do is, so first thing is, um, first thing is to survive, sorry, so first thing is stabilize the patients. Okay, stabilize the patient by stabilize the patient. Stabilization main motto or principle is to prevent the early contaminations. Okay, to prevent the early contaminations. And what is stabilization? Stabilization is the process by which you maintain the essential it is things for life and maintain the life of the patients. Okay, by maintaining following ABCD. Okay, right. Okay, ABCD. So later on you can assess the evaluation is the sense you can evaluate the patient. Okay, severity of the coma. If suppose the patient is enter into coma, you can evaluate the coma by following scales. So what scales said that in order to prevent the coma, you can give cocktail. Okay, coma cocktail, it is composition, and you have to correct the metabolic acidosis. Next, some drugs which cause some expected toxicities, you have to list out. Okay, what are the drugs which cause respiratory failure, which cause respiratory paralysis, tachycardia, like this. Okay, so later on, okay, you immediately, second step, immediately you can do gut decontaminations. Okay, you can do decontaminations. Okay, what is the decontaminations? Are nothing but decontamination, nothing but is a method of removing of poison from the GI tract. If the patient is ingested the poison orally, so then only this decontamination is helpful. Okay, sometimes it is helpful for the injected poisoning, especially morphine poisoning. Okay, so gut decontamination is the process by which you can remove the poison from the, okay, any part of the GAT. Okay, GAT. So with this you can stop the, okay, absorption of, okay, drug from GI tract into systemic circulations. So ultimately what is the thing you got from decontamination? You prevent minor exposure to major problem. Okay, you can control the absorption, with that you can control the severity of the poisons. Okay, so this is nothing but decontamination. You can just simply is a method of removing a poison from the GI tract. Okay, GI tract. So how to remove it? Okay, these are the so many methods are there. Okay, so the methods are, first methods are either induce vomiting by using emetics. Okay, by induce emesis, vomiting by using just how to induce emesis by using emetics only. Okay, next gastric lavage is a method to clean the GAT. Okay, gastric lavage, okay, by using cathartics, okay, laxatives and purgatives na, so cathartics are more follow, so that you can use cathartics. Next, by administration of activated charcoal, okay, activated charcoal. Next, whole bowel irrigation. So these are the 5 steps you can comes under gut decontamination. These are mostly helpful for orally ingested poisons. Okay, so next first thing is emesis. Okay, emesis is nothing, it is a method of inducing vomisis, okay, into the poisoned victim, okay, to emit, okay, to emit the GI content. With that, whatever the content, poison content present in the stomach, that is going to be expelled, okay, forcefully through, okay, so GAT, okay, and throat. So done by administration of syrup of ipecac. It is obtained from Syphilis epicacuna. So next, cephalin emetin, okay, so especially keep in mind, you can induce the emesis only in conscious patients and alert patients. You cannot induce the emesis in the unconscious patients, comatose patients. Okay, so what happen in such cases, the patient is unable to cause vomiting. Sometimes it will cause aspirational pneumonia, it cause complications. So you can use, okay, emesis by using syrup of ipecacuanha. Okay, so how ipecacuanha is going to be induce vomiting? Simply by stimulation of central nervous system. Okay, central nervous system. One more thing is this emesis with syrup of ipecacuanha, it is difficult for inducing vomiting in those who are receiving CNS depressants. Okay, if the drug is CNS depressants, poison is case, poison itself is a CNS depression, you cannot go induce emesis, because it cannot by stimulate the CTZ. Okay, it is not useful. Okay, syrup, so emit is induced by emetic. Okay, example is syrup of ipecacuanha. It induces vomisis by stimulation of the chemoreceptor trigger zone in the GAT, and also local irritation in the GAT is also one of the thing. Okay, dose for 30 ml followed by 250 300 ml water. Okay, so adults 30 ml, so children's 15 ml. Okay, so next, if vomiting does not occur within 30 minutes, repeat the dose. If no response, perform the stomach wash, remove the poisons, and ipecac consumed. Okay, next, if you can go 30 ml for adults and 15 ml for children. If vomiting does not occur within half an hour, then again repeat the same dose. Okay, if the no response, you don't give again emesis, simply you have to go for, okay, stomach wash. That is nothing but gastric lavage. Okay, complications, every process have complications. Okay, so emesis have complication, gastric lavage have complication, cathartics have complication. So every process have some like this, inducing of emesis have also complications. Okay, what is the complications? Generally you may see that aspirational pneumonia is a major problem. Aspirational pneumonia, maybe the patient may aspirate the vomitus into the respiratory tract, it cause aspirational pneumonia, sometimes arrhythmia and myocarditis. Okay, so these are the things. Malaria waste tears, it is a vomiting induced tears. Generally contraindications. Okay, you cannot induce the vomiting in the if the poison patients, maybe if the pregnant women, maybe children less than 1 year, old patients, those who are having coma condition, those who are having the convulsions. Okay, next is if the poison is a corrosive substance, and if the substance is a petroleum containing product, or if the emetic poison, so emetic poison. Okay, so these are the some contraindications. So when you contraindication are where the condition cannot induce vomiting, if the patient is pregnant, if the patient less than 1 year, if the patient is old, if the person is coming from coma, you are suffering from coma, and also if the person is person having the myocardial infarctions. Okay, so chances of myocardial infarction, ischemic diseases, if the patient is consumed corrosive poisons like strong acids and strong alkalis and pestilent products. These are all the in such cases you cannot induce vomiting. Okay, so drugs, examples of complications and contraindications of this. Next is